The gluteal region will be presented in several sessions. This is the first session, which includes an overview of the whole region.
Hello, my name is Richard Fernandez. I'm one of the anatomists out at La Trobe University's Bundoora campus, and I'll be presenting a clip on the gluteal region.
The bony features of the gluteal region correspond to those of the posterior pelvis. In particular, the posterior surface of the ilium and the ischium. You can see here the iliac crest superiorly, which ends at the anterior superior iliac spine anteriorly, and the posterior superior iliac spine posteriorly. Traversing inferiorly, we notice features of the ischium, most notably the greater sciatic notch, the ischial spine, the lesser sciatic notch, and the ischial tuberosity. In order to orientate the pelvis, we need to look anteriorly, and we see that the anterior superior iliac spine and this feature here, known as the pubic tubercle, lie in the coronal plane. In order to appreciate the ligaments of the gluteal region, we need to orientate ourselves to a posterior view of the pelvis, which we can see here. We can see our landmarks: posterior superior iliac spine, greater and lesser sciatic notches. The sacrum cannot be seen as it's covered over by the posterior sacroiliac ligament, which you can see here. This ligament stabilizes the sacroiliac joint. There are two other ligaments, the sacrotuberous and sacrospinous ligaments. They both attach between the sacrum, but the sacrospinous inserts onto the ischial spine, whereas the sacrotuberous inserts onto the ischial tuberosity. You can see that these two ligaments close off the greater and lesser sciatic notches, now making them the greater and lesser sciatic foramen. The broad structure of these ligaments also allows muscles to attach, most notably gluteus maximus. Now we should apply our knowledge of osteology to describe the surface anatomy. The gluteal region is defined as the area between the iliac crest superiorly and the gluteal fold inferiorly. Medially, there's the gluteal cleft, also known as the intergluteal cleft or the natal cleft, and the gluteal region extends laterally to the greater trochanter. Here we can see the muscles of the gluteal region, the gluteus maximus muscle, and how it makes up the majority of that region. In a lateral view, we can actually see how the gluteal region extends anteriorly. Here you can see it extending over to the anterior superior iliac spine and the greater trochanter. Located at this part is the tensor fasciae lata muscle, which is grouped with the other gluteal muscles. You should now stop the session and attempt the activity in the worksheet. First of all, try and label the osteological features of the hip bone you can see in this diagram here. Using this diagram in the center, you should list and describe the landmarks that define the gluteal region. On this diagram at the end, you should draw on the iliotibial tract and the muscles that insert to it. And finally, describe the exits from the pelvis to the gluteal region. We can now consider the layers of tissues that make up the gluteal region. Starting with skin. Skin is the first layer, and it's usually coarse and thick in males. Deep to the skin, we have a layer of adipose, also known as hypodermis. Adipose gives the gluteal region and the buttocks its characteristic shape. Both males and females deposit adipose in this region, but the amount of adipose varies between genders. Deep to adipose, we have deep fascia. The deep fascia is the continuation of the deep fascia of the thigh, so called the fascia lata. This fascia lata encircles the thigh and extends superiorly to cover the gluteal region, a lot like a pantyhose would cover the thigh and gluteal region. This deep fascia, or fascia lata, attaches to bony prominences in the gluteal region and also encloses the gluteus maximus and tensor fasciae lata muscles. Here you can see the fascia lata encircling the thigh and gluteal region and the gluteus maximus and tensor fasciae lata muscles. Now, a lateral thickening of the fascia lata presents as the iliotibial tract, so named because it extends from the ilium and descends all the way down to the tibia. Although this iliotibial tract is a superficial structure, it blends with the lateral intermuscular septum. So here you can see in this cross section the iliotibial tract blending with the lateral intermuscular septum. This lateral intermuscular septum in turn attaches to the linea aspera on the posterior femur. Another aspect to consider in the gluteal region are bursae. Bursae, or bursa singular, is basically a pouch of synovial membrane filled with synovial fluid. Its function is to reduce the friction between two structures that slide upon each other. I'd like to consider bursa as the anatomical superhero of the body, because wherever there is friction, bursa will be there. There are many bursa around the hip region, but there are only two important ones that you need to be mindful of. There's the trochanteric bursa. It basically reduces the friction between the iliotibial tract rubbing on the greater trochanter. The other bursa near the hip joint is the iliopsoas bursa. Here I've shown you the approximate location of it in a semi-transparent fashion to show that it actually is between the iliopsoas muscle and the hip joint capsule itself. It would basically act to reduce the friction between iliopsoas rubbing on the anterior part of the hip joint capsule. Now when we consider the concepts of muscle action at joints, the most important thing we need to remember is that a muscle must cross a joint in order to act at that joint. There are two main factors that would contribute to the efficiency of how muscles would act at a joint. And those are the muscle size and the mechanical advantage, also known as the moment arm. When we consider muscle size, we should appreciate that the larger the muscle is, the more force it can generate due to its larger cross-sectional area and greater number of myofilaments. A good example is gluteus maximus, located posterior to the hip joint, which is a very powerful thigh extensor. On the other hand, anterior to the hip joint, there is iliopsoas and rectus femoris. Now the combined cross-sectional area of iliopsoas and rectus femoris is small compared to gluteus maximus. So an application to everyday life would be that although iliopsoas and rectus femoris help flex the thigh so that we can take a step, the more powerful, larger gluteus maximus is there to extend the thigh posteriorly, thereby propelling the whole trunk and pelvis anteriorly as we walk. The other factor we need to consider is mechanical advantage. This refers to the moment arm, or the force generated along a lever. Muscles inserting further away from the joint have a greater mechanical advantage in that they will have a greater moment arm. Here we can see two muscles of the same size, muscle A and muscle B. Because muscle B is a greater distance away from the joint or fulcrum, it will generate a greater moment arm, or it will have a greater mechanical advantage. Down here we can see a good example of gluteus medius indicated in red. Because it's inserting here near the end of the femoral neck, depicted by this blue lever, it would have a greater mechanical advantage than if it was inserting anywhere along this lever closer to the joint. We should appreciate that when muscles cross a joint, their location relative to the joint will dictate the movement possible. For example, flexors cross joints anteriorly, extensors cross joints posteriorly, adductors cross joints medially, and abductors cross joints laterally. Rotators, on the other hand, they can cross joints both horizontally or obliquely, and you'll come to see some of those in the session on the deep gluteal muscles. I should also point out that below the knee, flexors actually cross joints posteriorly and extensors cross joints anteriorly. Here we have a diagram that shows the muscles of the gluteal region. Here we can see gluteus maximus, quite superficially. If we traverse over, we can see gluteus medius muscle. If we cut that away, we're greeted with gluteus minimus muscle. Here, anteriorly, we can see the tensor fascia lata muscle. The bottom row of muscles are all the lateral rotators. We can see piriformis, we can see the two gemelli, superior and inferior gemellus, and obturator internus, as well as quadratus femoris. Now when considering concepts of nerve supply, one of the most useful concepts to apply is Hilton's law. Hilton's law states that a nerve that supplies a joint will also supply the muscles crossing that joint and the skin overlying the muscle and its insertion. So this nerve should have an articular branch for the joint, a muscular branch for the muscle, and a cutaneous branch for the skin. When we apply this to the gluteal region, we should appreciate there are three main nerves. There's the femoral nerve, which lies anterior to the hip joint and supplies rectus femoris, one of the quadricep muscles, the only quadricep muscle that crosses the hip, and pectineus, which is an adductor. On the medial side of the hip joint, we have the obturator nerve, and the obturator nerve also goes on to supply the adductor muscle group and the lateral rotators, most notably obturator externus. Finally, the superior part of the hip joint, or posterior-superior part to be exact, is supplied by the superior gluteal nerve. Now, although the superior gluteal nerves also supplies the abductors gluteus medius and minimus, it does not supply the cutaneous region superficial to these muscles. It's very important to note that the cutaneous nerves that supply the gluteal region are actually branches of posterior primary rami or dorsal rami. This concludes the first session, the overview of the gluteal region.